Hey guys, Keto Coach Neil here. Today I want to talk for just a few minutes about metabolic syndrome, something that a lot of us have heard about, but what is metabolic syndrome? How do you know if you have it? And why should that matter? It's been on the rise for quite a long time, a lot of different studies. Uh, the latest one that I saw is that it's gone up from 37.6% in 2011 up to 41.8% in 2018 of the US population has what's known as metabolic syndrome. A syndrome is simply a collection of symptoms. So there's a bunch of different symptoms. If you have, in this case, 3 out of 5, then you can get from a doctor, you could get a diagnosis of metabolic syndrome. And that study was from a meta-analysis in 2023 from Oxford. So, according to the National Heart, Lung, and Blood Institute, metabolic syndrome is a group of conditions that together raise your risk of coronary heart disease, diabetes, stroke, and other serious health problems. Metabolic syndrome is also called insulin resistance syndrome. So you can see that it's going to be important to us, especially those of us that are trying to adopt a proper human life and a proper human lifestyle and diet. So here are the 5 things, the 5 criteria for metabolic syndrome. Number 1, abdominal obesity. Getting a little bit thicker around your midsection. You're carrying more weight there. Could be a subcutaneous fat. The danger is visceral fat. That's just hanging around your organs. So abdominal obesity specifically. High blood pressure, hypertension. If you are consistently over 130/85, the NHLBI says that constitutes high blood pressure, plus or minus, depending on which governing body that you look at. But hypertension, a diagnosis of elevated blood pressure. That's number 2. Number 3, high blood sugar, insulin resistance, or chronically elevated blood glucose. So if your fasting glucose is at 100 or higher, consistently fasted, this is not after a meal. This is you've been fasting for hours and hours, and you're still over 100. That's another criteria. High triglycerides is number 4. If your trigs are over 150, then which is the upper end of the reference range from LabCorp and Quest. If you're over that, then you have another symptom, another criteria of metabolic syndrome. And the last one is low HDL. Some people call it the good cholesterol, but low HDL, if you're under 40, under 40 for men, under 50 for women, that's going to constitute condition of metabolic syndrome. Now, ask yourself, do I have 3 of those 5? Do I have 1? Do I have 2? If you have 3 or more of these, you could have metabolic syndrome. Have you had trouble losing weight? Have you had trouble sleeping? Have you had elevated blood sugar? Have you had hypertension? All of these things can manifest in a number of different ways. But these are the criteria to look at to see if you have metabolic syndrome. Now, how can you prevent it? We know that if you have it, here's what it is. Here's how you know if you may or may not have it, and what kind of conversations you can have with your doctor, with your provider. How do you prevent that? Let's say that either you get a diagnosis and how do I deal with that? Or just, I don't even need a doctor to say, I know that I've got at least 3 or 4 or 5 of those. How can I be proactive with my health? A couple things you can do. First thing you can do is start eating a low carbohydrate diet. This will over time improve your insulin sensitivity in most cases. Your blood sugar, your blood glucose will become lower, manageable, and your waistline should begin to reduce after that. Subcutaneous, but then also the visceral fat. Your trigs will begin to drop as your body starts becoming more efficient in pulling the lipids out of your bloodstream for use. Your blood pressure may start to come down as your body gets rid of the inflammation that's caused your blood pressure to go up in the first place. It's caused by insulin resistance caused by stress, by cortisol. All that stuff's going to raise your blood pressure. It's going to raise your glucose. So low carbohydrate diet is going to help get these things down. Your HDL will most likely begin to rise just by adopting a low carbohydrate diet. Try it for 90 days. 30 days, 60 days may not be long enough of a trial, of a sample period, but a good consistent 90-day run of a proper human diet, a low carbohydrate, somewhere on that spectrum, 90 days, you should begin to start seeing some results. I know my metabolic markers started to improve dramatically after about 6, 7, maybe 8 weeks. After 6 months, Katie bar the door. Things off of my blood pressure medication, my trigs went from 488 in 3 months down to below 245, and now they're well below that 150. Now that took some time to do it, but you will begin after 90 days, most likely. You're going to begin to see a lot of changes to your health markers in a positive direction. So a great way to do that is what's called triple B&E, beef, butter, bacon, and eggs. And that's going to be a great 90-day run to help you get on the path to preventing or reducing metabolic syndrome. So I hope this helped. See if you have, ask yourself, do you have 3 or more of those criteria? If you do, take some steps to prevent it. Reach out. We can help you. Glad to help you. So with that, have a great rest of your day, and we'll see you next time.